So you've got promising new data on a new COVID treatment. Tell us what you discovered and how did you find it so quickly, given that this variant is so new to us?
Well, it's not new since the Omicron variant. This is an antibody sotrovimab that we started working on in February of 2020 and was approved provisionally approved under emergency use authorization in the US, and now is approved in many countries around the world to treat COVID-19. And it does reduce hospitalization by 79% in the phase 3 trial. So it works quite well. As new variants arise, we and other companies who make antibodies, I'm sure, test the new variants to see if our antibodies still will retain the ability to neutralize them. So we've done that for every variant that's arisen: alpha, beta, gamma, the whole litany of Greek alphabet strains, including delta and mu, and our antibody continues to be able to control them. The Omicron now, which has only been available now to be examined for a couple of weeks, you can look at the DNA sequence and you can tell whether there's something in there that tells you your antibodies are unlikely to work. And you saw maybe announcements from other companies that their antibodies were unlikely to work. When we look at it, we see the mutations that are in the Omicron variant. We've tested most of them, almost all of them, individually. We know that our antibody retains activity against all of them. And what we don't know is when you put them all together in the same virus, whether we will retain activity. We expect that to be the case, but until we demonstrate that experimentally, we have to caveat that a bit. Okay?
So right now you've been doing most of this testing in a lab, as I understand it. Are you going to start testing this on humans, actual human cases of Omicron?
Well, yes. I mean, it is being used in the US and in many countries around the world. It is one of the 3 antibody treatments that has been purchased by the US and is being shipped to places around the country. And as Omicron continues to expand in the US, if that does happen, then of course we'll have data on Omicron. And we are working also with authorities in other countries, South Africa, for example. We would like to get our antibody tested there as well, just to confirm.
Given this promising news, I mean, is the United States government potentially expanding its purchase agreement with Vir for more of your treatment?
I think right now, we are optimistic about the ability of sotrovimab to contain the Omicron variant. We will have data to confirm that, or not, but hopefully to confirm that within weeks. And so I think once we have those data, I anticipate there'll be a lot of interest from governments all around the world if we have those data.
Now, President Biden today announced some new measures to fight COVID in light of Omicron. Let's take a quick listen to what he had to say.
We're expanding our national booster campaign to provide booster shots to all eligible adults. Our docs and the scientists believe that people who get a booster shot are more protected than ever from COVID-19.
Do you think that what the U.S. is doing now is enough?
No, I think he's right. Everybody should get vaccinated. All vaccinated people should get boosted. That's the best thing we can do. If everybody in the country did that, we would have much less of a problem. I think we need much, let's say, more drastic remedies here. Not necessarily social ones, but we do need social ones. Masking is a good idea. I don't understand the controversy. It's not that big an imposition, and it does reduce transmissibility. But distribution of drugs, distribution of the antibodies, distribution of test kits. I think that was also part of his announcement, to make test kits increasingly available. All that should be done. All that, and there needs to be close coordination with, I think, with the industry and the government. This new Omicron variant that has everybody so upset probably is not the last one, right? There'll probably be other variants that come down the pike, and we need to be ready for them. And we know enough now to know how to be ready for them. And so the industry, biotech industry, pharma industry, and the government have to come together and work carefully, as they have been, but I would say in an expanded way, to make sure that not only we get COVID under control, but that we're prepared for whatever the next pandemic is.